everyone, I am Ronaldin P. Madlang Bayan, a student nurse from Section BSN 1A in San Sebastian College, Recoletos de Cavite. And for today, I will be demonstrating the process of doing a range of motion exercises on a patient. But before I proceed, let us first know its definition. Range of motion exercises may be passive, active, or active assisted. It's also the movement of the joints through the full range of all appropriate planes. So range of motion, there are three main purposes. The first one is for the maintenance of the joint function. The second one is for the restoration of joint function that has been lost to disease, injury, or lack of use. And the third one is for the shortening of the muscles. The first procedure in doing the range of motion exercises is assessment. So, the first one is to assess the joint mobility and activity status, wherein I will ask the patient if he can move his neck, shoulder, elbow, wrist, and also the legs. And the second one is to assess the general health status of the client, wherein I will check the patient chart to know the subjective data of the patient. And also, I check the health status. And the last is to assess the client ability to participate. In this step, I will personally conclude if the client participations in the said exercises. So, by checking the health status.
Come in.
Hello sir, good afternoon po.
Good afternoon.
Hello sir, good afternoon. I am Ronaldin P. Madlang Bayan, your student nurse for today. So, may I know what is your name po?
Premier A. Potante.
How old are you?
11.
When is your birthday po?
October 8, 2020.
So sir, before to start, I check your mobility first. So pwede po, may I request na pakigalaw po ang inyong neck and your shoulder and elbow. So very good. And based on your health records, ay normal naman po lahat at healthy ka. So, yun, pwede ka pong mag-participate sa gagawin nating exercise. Okay na ba po yun sa'yo? Okay. After that, the next procedure is planning. So, we need to plan when the time of exercise and what the type of exercise, and also gather the equipment, and don't forget to wash hands. So, sir, ang gagawin po nating exercise will be start in 4 p.m. It's okay ba po yun sa'yo? Okay. So, the type of exercise we'll do is a range of motion. So, sir, babalik po ako dito ng 4 p.m. para po sa gagawin nating exercise. Okay? And the last procedure is implementation. So, we need to identify the client, explain the procedure, and provide privacy. And make sure the patient is in a supine position. And next is to check or to get the vital signs initially and repeat in between procedure, and next is to follow the procedure. Hello sir, it's already 4 p.m. na po, so mag-i-start na po tayo. Before that, I explain first what we are going to do. So now, I'm going to do is to assist you to perform the passive range of motion. It's okay with you, sir? Okay. Before handling the patient, we must ensure that we perform hand hygiene. So in this case, I am already hand washing and put some gloves. So first, we're gonna do the range of motion for neck. First is neck, flexion, and extension. So in doing this, bring the chin to the rest of the body, like this. Okay, sir? We're gonna do the flexion and extension. Okay, 1, 2, 3, go. Flexion, extension. Flexion, extension. Front, back, front, back. Last one. Front, back. So in doing this, we do the 5 moves in every exercise. So that's the first exercise for the neck. And the next is hyperextension. So in doing this naman is just gently till the head going to the backward. So like this. Okay. Okay. Hyperextension. Hyperextension. So that's the flexion and extension and hyperextension in the exercise of the necks. So now we're gonna do for the lateral flexion. So this is how we do it. Tilt the head toward each shoulder. So sir, let's go. Let's do the lateral flexion. Okay. 1, 2, 3, 4, 5. The other side. 1, 2, 3, 4, 5. Good. So that's the first exercise in a range of motion neck. So sir, good morning. I am Ronalyn P. Madlangbayan, your student nurse for today. So now we're going to do is perform a passive range of motion for shoulder. It's okay with you, sir? Okay. So now we're going to do the range of motion for shoulder. So the first one is flexion and extension. Okay, sir, can you give me your hands? Flexion, extension. Flexion, extension. Flexion, extension. Last two. Flexion, extension. Flexion, extension. Okay. After that, the abduction and adduction. So, we're gonna do the vertical abduction and adduction. Abduction, 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 abduction. Okay. 3, 4, 5. After that, we're gonna do the internal and external rotation. Okay. Internal, external. Internal, external. 3, 4, 5. Now, we're going to do the range of motion exercise for elbow and wrist. So, let's start to the elbow. Okay, can you give me your hands? Let's start the flexion and extension for elbow. Okay. Extension, flexion, extension, flexion, extension. Okay. 4, 5. And next is sa wrist naman. Let's start to the flexion and extension to the wrist. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Last one. Flexion, extension. So after that, in the radial and ulnar deviation. So first, we do the radial flexion. Okay? Yes, sir? Radial. Okay? 1, 2, 3, 4, 5. And next to the ulnar flexion. 1, 2, 3, 4, 5. So, and that's it. So now we're going to do the range of motion for fingers and thumb. Okay? So, sir, let's begin. Let's begin to the fingers for the flexion and extension. Okay? Flexion, extension. Flexion, extension. 3, 4, 5. So that's the flexion and extension. And next for the hyperextension. Okay? Hyperextension. Okay? Hyperextension. Hyperextension. 4, 5. So that's the hyperextension and flexion and extension. And next, let's move to the abduction and adduction. So, sir, can you spread your fingers? Spread. So, this is the abduction. Can you closer your fingers? So, this is the adduction. Okay? Abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. So that's the abduction and adduction. And now let's move to the circumduction. Okay? Circumduction, 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 circumduction. Last 3, 1, 3, 4, and 5. So that's the circumduction. And let's move to the opposition. So sir, till you get your thumb to the little finger. Okay? One more. Saka po. 2, okay? 3, 4, 5. So that's the flexion, extension, hyperextension, circumduction, and then the abduction, adduction, and the opposition for the range of motion exercise for the fingers and thumb. Now we're going to do the range of motion for the hip and knee. Okay, sir, it's okay with you if I expose your one leg? Now we're going to do the flexion and extension. Okay, sir, let's go. Flexion, extension, flexion, extension. Okay, 3, 4, one more. Alright. That's the flexion and extension. And now let's move to the abduction and adduction. Okay? Abduction, adduction, abduction, adduction. Okay, 3, okay, 4, and 5. Very good. And that's the abduction and adduction. And now let's move to the external and internal. Okay, rotation. Okay, 1, 3, 4, and 5. Okay, let's move to the external rotation. Okay, 1, 2, 3, 4, and 5. So that's the abduction. So that's the range of motion for the hip and knee. So for the range of motion ankle, let's do the dorsal flexion and plantar flexion. Okay? Dorsal, plantar flexion. 2, 3, 4, 5. That's the dorsal and plantar flexion. And now let's do the circumduction. Okay? 1, 2, 3, 4, and 5. So that's the circumduction. And now let's do the eversion and inversion. Okay? And now let's do the range of motion for the fingers. For the toes rather. Okay? 1, 2, 3, flexion, extension, flexion, extension, flexion, extension. So that's the range of motion for the toes. So now we're going to do the range of motion for spine. Go to the flexion, flexion, extension, hyperextension. Okay? Okay, again, flexion, extension, hyperextension. Last 3, flexion, extension, hyperextension. Okay? Flexion, extension, hyperextension. Last one, flexion. Okay? Alright. So now let's do the lateral rotation. Okay. 1, other side, 2, 3, other side, 4. Okay. Okay, last one. So that's it. That's the lateral. And now let's do the rotation. Okay. 1, 2, 3. Right, that's the rotations. So that's it. That's the range of motion of spine. After doing the range of motion exercises from neck to spine, and now we will proceed to evaluation. In evaluation, I will personally evaluate if my client or my patient experience fatigue, joint discomfort, and joint mobility during the set exercises. And the last procedure is documentation. So in this documentation or in this document, the type of exercise and exercise performed and also the response of the client.